Chapter 15, Pharmacy Operations Management and Workflow. It takes a team working together to keep the pharmacy and any healthcare organization running smoothly and efficiently. The layout, the equipment placement, arrangement, responsibilities of team members, standard operating procedures all factor into how the pharmacy operates and functions daily and as a whole. Changes in roles of both pharmacists and technicians are changing the way a pharmacy manages daily tasks and patient care. The knowledge requirements for technicians are increasing pretty heavily. That comes with additional leadership and advanced roles, as well as legal responsibilities. To meet the demands of a patient's overall wellness, today's pharmacy techs must understand not just their place in the pharmacy, but in the overall healthcare system as well. The healthcare team members must work together to deliver the highest standard of efficiency and patient safety. The ASHP Pharmacy Practice Model Initiative has a significant focus of advancing the health and well-being of patients and maintains optimizing the role of technicians is critical to this goal. Technician education, regulation, and basic knowledge levels are key to providing safe patient care and efficiency in providing those services required to keep up with the increasing complexity of healthcare and declining reimbursement. Pharmacists and technicians must work as a well-organized team and integrate pharmacy, wellness, and disease prevention services with other healthcare providers. ASHP and PTCB recently held a stakeholder consortium to discuss the future of the pharmacy technician profession and emphasis on leadership, advanced or specialty roles, and requirements to practice were discussed. The State Board of Pharmacy requires physical standards such as a sink with hot and cold running water, appropriate lighting, and minimum amounts of space. In community settings, there are common areas such as the following. So the automated long-term care equipment area, compounding area, counseling area, room, counter space for inventory check and processing, data entry and or filling stations, drive-through window, durable and non-durable equipment, front counter register with intake and pickup window areas, offices for billing or physicians, calls, reconstitution area, stock, and OTC and miscellaneous product shelving. This area may include scanning technology that also connects with the automated counter. If being used, automation can be found in most community settings and is an integral part of distribution. The filling and data entry areas may have the machine within it, and inventory is maintained as items are depleted and at the end of the day. Technicians often manage this equipment and they are assigned to just the task of keeping the inventory replenished. In a busy pharmacy, there is a constant need to restock canisters and monitor counting machines. The flow of this area must work well, and all personnel should understand each role. Beginning with data entry, the entire process must be organized and follow for interruptions to the process, such as insufficient inventory or a problem that requires a physician call. For instance, there should be waiting bins or a filing system to identify prescriptions that require additional attention. Workflow interruptions should not stop the pharmacy from performing the required daily tasks for other customers. Customers may approach the front counter with questions regarding instructions from a physician or have questions about treatment options. Workflow and organization are important considerations because having a technician leave the pickup area or the drive-through window to assist a customer at the front counter can cause a backup if the customer requires a lengthy discussion. There should be a backup plan in place to accommodate such a situation. Another technician should be prepared to either assist or take over the area left unattended. Reconstitution or compounding areas are often included in today's community pharmacy areas and can sometimes act independently of the retail section. Technicians may be assigned to this area and rotate to the front periodically. The inventory and layout vary somewhat as the process of compounding consists of bulk medications and of various measuring equipment. Movement still needs to be kept to a minimum. Counters are standing height, and technicians operate independently from the regular prescription processing in the front. Roles can be data entry, billing, inventory, and ordering, preparations of those compounds, delivery assignment, and documentation. Counseling and pickup areas are the last sections of the pharmacy area that a customer sees. Counseling may be performed only by a pharmacist, but to keep the workflow efficient, a technician can play a valuable role in identifying these customers and inform the pharmacist that a customer is waiting, or offer to relieve the pharmacist to enable him or her to spend one-on-one time with the customer. When a customer picks up a prescription, always ask an open-ended question such as, "What are you allergic to?" rather than, "Are you allergic to anything?" An open-ended question requires more than a yes or no answer and can prevent medication errors. To accommodate the increased number of patients who are elderly, as well as the increased number of patients with more complicated disease states, pharmacies often include a section for long-term care packaging in their practice. This section may also include automation for packaging either in 30-day blister cards or strip packing. Medications are put into individual pouches that list the medications and identify each one by color, size, and shape. The directions are provided on the pouch, and the strip is continuous for a 30-day supply for each patient. Verification is performed by a laser check system, and a 30-day supply of breakfast, lunch, and dinner medications are prepared and placed in a box for delivery. Patient compliance is enhanced significantly as each pouch holds all of the medication for that dose time, which eliminates transferring to a pill box or taking from an open bottle of loose pills. And here's kind of an example of a 30-day box with the patient's medications in a strip. Here is a canister for refill for the automated packaging machine, and some special trays that are filled for that. Blister package cards are also used for patients in assisted living or long-term care facilities. The card contains blister or bubbles that hold doses of each medication. Each bubble is individual and punched out when the dose is to be taken. This packaging area usually has several technicians and its own pharmacist, and it's separate from the front operations in the retail setting. Many chain independent pharmacies are now including medical equipment services and delivery to customers. As the population of elderly people increases, with many patients remaining in their homes and using in-home care, the demand is increasing for durable medical equipment such as beds, walkers, wheelchairs, and respiratory equipment. Technicians need a basic understanding of this equipment as well as other non-durable products, such as those for wound care, ostomy, diabetes, cancer, and other treatment-related items. Physicians may call into a direct line or order these supplies in the DME department. These supplies often require delivery, setup, and third-party billing. So in that section, they're going to have technicians who perform the data entry and phone calls, dedicated insurance billers, someone for a direct personal line to help patients, and so on and so forth. Workflow management in the institutional setting varies due to the associated daily activities and critical tasks. Hospital pharmacies have a main department Generally located in the central hospital with satellites located in areas such as critical care, the OR, surgery or recovery, the emergency department, and the neonatal nursery. These satellite pharmacies will usually have their own technician and pharmacists who work in the area directly with that healthcare team. Hospital pharmacies may also have an outpatient department where daily operations perform as a community pharmacy. There may also be a specialty chemotherapy pharmacy where technicians prepare sterile cancer drugs. The main dispensing pharmacy will be separated into areas such as the automated dispensing machine area, the CPOE order entry area, emergency or disaster medication supply room, filling area with pickup window and pneumatic tube, inventory area and storeroom, intravenous IV room, narcotics area, OR tray and crash cart restocking, the repackaging area, bulk for unit dosing, excuse me, stocking area for non-clinical area up for other departments such as central supply or emergency medical services. The layout of a hospital pharmacy usually includes a large room divided by counters or partitions with some offices included. The CPOE area is a bank of desks that should be located in a quiet zone where data entry and phone calls between pharmacists and other healthcare workers, either inside or outside the facility, can occur with minimum interruptions. This is where orders are scanned or faxed to the pharmacy and processed for filling or supplied in an ADC. If the order for a medication needs to be in an ADC on the floor, the technicians in the automated dispensing area will perform the next step in the workflow. Each medication kept in the ADC must be individually packaged, and if stock is insufficient on the floor, a technician must deliver it to the cabinet. Medications are entered from orders sent from the floor. Once a label has been printed, the technician chooses the stock, counts out the amount, and packages the medication in unit doses. If the medication has to be repackaged from bulk stock, the technician may work with another area to get this accomplished. The other similar area may be located within or near this area is the window pickup or pneumatic tube area. Once an order is entered in the CPOE area, if the medication is not appropriate for the stock of a cabinet, a label will print and technicians in this area will fill the order manually. Another critical area to dispensing is the narcotic area. Medications in this area require special attention and storage, and workflow should be in a minimal or low flow traffic area and again, quiet. Technicians can be assigned to this area and work within it on a daily basis. It may be a specialty or advanced technician opportunity because it entails additional knowledge and increased responsibility. Controlled medications are stored in an automated system with computer inventory tracking, and the technicians will be responsible for preparing singles and batches for delivery. A pharmacist is usually assigned to the area because it is busy and requires constant attention. Another busy packaging area that relates to all the other supply areas must coordinate well because the medications required for automated dispensing systems must be in unit dose or single packaging. The repackaging area is a busy hub with medication storage in bulk form. So like from 100 to 1,000 capsules or tablets, for example. Barcoding and NDC technology are key to ensuring quality and accuracy from the patient's EMR to the actual cabinet pocket entry. The medication can be tracked and errors and diversion can be averted. The IV room is a unique area that requires special training and procedures. Guidelines established by the ASHP and USP 797 publish the layout, equipment, maintenance, training, and all procedures related to preparing these medications. Some non-clinical stocking or outside areas such as central supply and EMS will also be stocked by the pharmacy, and this inventory may be kept in the back in the main shelving or overflow area, or can have a dedicated space within the dispensing area. Depending on the size of the facility, technicians and a pharmacist may work in a section which will be close to other dispensing areas. If this stock is only maintained in the back main storage shelving, any technician may pull items needed as requests are made. This area may be located off of the main dispensing area, but close to an outside entry because EMS will bring in boxes used on a call that need medications replaced. Operating room surgery maintains trays with procedural medications, one for each case, which have to be maintained by the main pharmacy. The technicians in this area restock the trays and carts left for replenishment. Inventory for these medications is different and usually shelved in its own section. Code drugs, for instance, which are packaged with ready to inject syringe and bags of IV fluids, are items normally kept in EMX boxes and code carts. Another common area kept in a hospital's main pharmacy is for disaster or emergency medications. A hospital may often house a special section for the community in a case of a disaster, and a technician may be dedicated to this area. The inventory is maintained separately and consists of antibiotics, maintenance medications, and other items such as batteries that would be necessary for the public in an emergency situation. All of the areas must coordinate items required for ordering with the inventory technician or department. When proper workflow management are put into place, a pharmacy can provide quality and safe patient care while minimizing time and expenses. Establishing a baseline or a starting point is key, and it is the first step in creating a quality assurance process. Quality control is taking those established plans and discussing and making them into activities that prevent an error or make a process better. Utilizing a quality assurance process to ensure practices and daily tasks should be monitored by SOPs and established by setting goals, making observations, performing evaluations, and obtaining staff feedback. So some ideas for the community setting to improve quality and workflow. Use automation and technology to assist in error prevention, efficiency, and accuracy. Barcode identification and NDC scan verification can shorten the time to process orders, improve inventory control, and reduce medication errors.